I would like to present to you our next speaker, Vladimir Brusic, professor in computer science, University of Nottingham, Ningbo, China. He studied at University of Belgrade, Serbia, La Trobe University, and Royal Melbourne Institute of Technology in Australia, and Rutgers University in USA. His research expertise is interdisciplinary: bioinformatics, health informatics, mathematical modeling, predictive analytics, artificial intelligence, and machine learning. He developed new software solutions used for scientific discovery and optimization problems in medical diagnosis and monitoring of human health. Vladimir, the stage is yours.
Thank you. I'm always happy to come to Belgrade. And when I was young, when they were building Sava Center, I could see it from my window. It was a wonderful view. And it is my first time to be in Sava Center, by the way. So today I will be talking about Smart Health Home. This is my main project at my Smart Medicine Laboratory in Ningbo, China, which is at the University of Nottingham. We have a campus, 3 campuses around the world, and one is in China. And I will be talking about 4 different aspects of, we want to make Smart Health Home work. So we need to take care of about all stakeholders. And it's complex, and I will tell you the conclusion already at the first slide. Technology is not a problem for Smart Health Home. We can make everything. We have technology, we have everything, automation. Healthcare is not a problem. There is telemedicine and home healthcare, and it's already in practice. Legal, normative, regulation, this is a problem. It is similar to what we were talking about, regulation and legal aspects of AI. This is a combination of all of these things. And the conclusion is that this is mainly socioeconomic project. How can we satisfy the requirements for everybody who is in ecosystem? And I will tell you how we are solving this problem. So first, I will talk about technology, then we'll talk about health aspects of that, normative, and then socioeconomics. How do we make people use it? How do we make doctors use it? How do we get government to accept it? Insurers and all others. And conclusions are already shared with you. Okay, next slide, please. Oh, I can do this. Automation. Okay, and I can see it here as well, so it's pretty cool. So we have healthcare delivery models are changing, and we have pretty much we are in constant transition and reform of healthcare system around the world. It's becoming too expensive and less accessible for people. Technology is everywhere in there, but it makes it much more complicated than it used to be. And the main problem for doctors is to catch up. And the biggest problem for doctors is when they see a patient to get all the background data and understand really, have some proper summaries. And here we have all the different health parts. We have community healthcare, health stores, like all the businesses, clinics and same-day care, so it's ambulatory, hospitals, virtual home, all kinds of things need to be in part of health ecosystem. And the most important is that we have actually changed from hospital care, where there is majority, to home care, and the emphasis is on prevention of disease rather than treating existing disease. It's too late and too expensive. And so what is Smart Health Home? There is Smart Home, there is a lot of publications on Smart Home, there is Smart Health, but Smart Health Home doesn't exist. So Smart Health Home focuses on monitoring and prevention. And it is expected to be working. It has to provide for medical grade monitoring. It has to be the same as medical device, otherwise it's not going to work. Then it has to be used by medical doctors and patients. All of things that we use in hospital must be done by qualified medical personnel, and a product of those measurements and observation is legal document, which is medical document. And patients are not allowed to do that. Electronic health record, patients cannot actually modify it, have access, right of access and sharing, but they cannot change it. And it must have high level of automation, like telemedicine, and it has to be compliant with the legal and regulatory requirements. So we have new model, there are new roles in the whole health system, which is based on smart health home, and we have, of course, new challenges. An ideal smart health home must be effective in improving outcomes. It must be working. It must be effective. And of course, it has to be compliant with regulation, otherwise it cannot be deployed. And it must be useful to all stakeholders. Remember, it has to be useful. And this is how we did it. We have this, this thing about there is a home, and home needs to have edge computer. It must be connected to the data exchange center, and there is complex interaction about exchanging the data with hospital or with clinic. And this is where compliant comes, because this is health data. And how do we do it so that there is privacy and security of data is ensured? And also we had these talks today, and there must be also data transfer to third parties, to public health authorities, to government agencies, insurers, for research. All of these things need to be satisfied. And we also need to scale it up. It's not good enough to have one smart health home, but we have communities where we have multiple measurements. This is the only way how we can actually get the data useful. This is at government level and insurer level and big hospitals. And we can have supercomputing options for hyperscale applications, because it can be scaled up to national level. In America, they're trying to do that, but it's becoming very difficult because integration of medical data is very complex. And because of that, I propose that Smart Health Home is a laboratory. We don't do medical decisions there, but we do measurements which are done correctly, following standard operating procedures. And we have legal documents that when we see it, we know which device was the measurement made with, who did that, at what time. And also we need to have calibration results for that. We need to know that it's working. And then in that case, we can start building the whole big system. And when we talk about smart cities, this is how we can actually integrate health into smart cities. Okay, so this was about introduction. So about technology, we already have solutions. The problem of remote surgery. And we have these things, or we have this retinopathy, eye disease, where AI, we can do the measurements, and AI can do 95% correct diagnosis, which matches what the best ophthalmologists do. So basically, we have examples where AI works, and also robotic surgery is usually at remote places, mines somewhere in the mountains, battlefield. And we have those robots which are connected, and at one side we have imaging, machine is there, and these images are transferred 1,000 kilometers, 2,000, 5,000 kilometers away. We can do these things. As I said, technological solutions are there. Then movements are done here, watching the images from other side, and the doctor moves the thing, moves the knife, or does all the devices, and the robot over there just follows what surgeon does. Of course, they have to be more precise because they don't have direct feeling, but these solutions exist, and they have already improved health outcomes from operations remotely. Okay, so this is what we are doing here. This is our Smart Health Home. So, that's okay. So I have those wearables here. This is commercially available wearable. This is thing that we are doing. So we can use all these things. And this is how we have Smart Health Home. Sorry, two sides. And so we have the like smartwatch. You can measure heart rate, oxygen saturation, activity, movement. And chest strap, this is electrical based. This one is optical based, diode and sensors. And we actually connect this through mobile hub here. We connect it to some kind of mobile device if we want. And we have edge computer where we are developing algorithms here. So technology exists, but we don't have good algorithms for interpretation of results. This is where there is actually a big gap, and this is where a lot of business can be done. So when we talk about medicine, now this is technology. Pretty much everything that we need to set up the home exists, but it's not connected and it's not accepted at the moment. So what we have here is that we have mega trends changing society. All of us here are well informed about. We are all machine learning data analysts, AI people, and we know that we have changed demography, aging, sedentary lifestyle, people are mobile, we move across, dietary changes, and more and more people live in cities, very few in the villages. We have actually dying villages around. Economic changes, basically center of activity, are changing. People who are here in the center of activities. We are in very big demand, and there are some other fields which are not, which are under pressure. And we need actually to support them because it's not good to have imbalanced environment. And technology, we have all this instrumentation, automation, ICT, information communication technologies, 5G, Internet of Things, Internet of Medical Things, smart everything. It's booming area. And environment, there's changing climate, there is pollution that we are producing on a massive scale. And in medicine, it all different diseases. Very rarely we have infectious diseases, and we could see with coronavirus it was very different than what we know about. And patients are better informed. We have access. The new generation, my students, they're horrible. They get half information from the websites, and they know everything. I say, how about thinking about solving the problems? For them, solving the problems is just going somewhere and finding site that I like. And this will be the answer. We cannot do that. Actually, I'm giving them a hard time when they do that. And so we have increase of regulation. And we had this talk about Europe. Europe loves to regulate. I know that they were regulating the curvature of cucumbers, how much they can be diverting from the straight line. And in many of those things, this is futile exercise because technology moves faster than our ability to regulate it, even to understand what are the consequences of technology. You know, these emerging properties of environment based on new technologies. And in medicine, we have mHealth, mobile health, evidence-based medicine, so it's based on facts. That's why I say Smart Health Home must be collecting the measurements as laboratory, a fact. Decision has to be done by somebody who is qualified. Automation of diagnosis will be very difficult because we are all different. We were talking about differences. And if we have 5 people here talking about coronavirus, most of us got infected. We'll be having all different kinds of symptoms and different parts of the body that will be attacked. I got it in stomach when I got my infection. Telemedicine is there, and we have shortage of physicians. They don't have time. They're overwhelmed by, and we found that in China, neurologists had on average 6 minutes to see the patient. And I wouldn't want to go and visit a doctor who has only 6 minutes for me. 8 minutes. Yeah, we beat Chinese. It's really serious problem. Okay? So when we talk about big data, these are all different things which are done in hospitals and in the whole system. Medical claims, mobile data, non-retail outlets, hospitals, electronic health record provider software, opt-in genome registries. There were all talks today about these things. Patient registries, disease registries, private payers, who is paying for that, government health plans, pharmacy, so many. Okay, problem with medical knowledge doubles every month. And because knowledge is also medical data, what I'm collecting here, and it goes into, I'm collecting data here at 16 hertz. And the raw data is being stored on the mobile phone. When I go home, it will transfer to my edge computer. Of course, I need to have Smart Health Home at home if I'm talking here to you what it does. And it's an enormous amount of data. And how do we exchange? What kind of data I exchange? It's a big problem. Oh, blockchain. How about doing blockchain? You want to get all my time series from 3 sensors that I'm wearing? We want to combine it with other. How do we do that? This is not viable. There are solutions for that. We'll talk about it. But the problem is that this is only 2020, and all the 5G, all kinds of things are now, we just don't know what to do. And the problem is not so much about storing, the problem is how much electricity we need to access it, and we have energy crisis looming. Particularly with electric cars and all things, we'll not have a lot of enough energy. So for those who go into investment, if you find a good company that will survive, you can make a lot of money for those who can do a sustainable electrical supply. I'm not giving financial advice, I'm just giving an example. This is my legal protection because I can be sued for pretending that I'm financial advisor and I'm not qualified. This is regulation exactly the same as we are doing in medicine. It has to be very, very clear. So this is just my opinion, it's not professional advice about finances. So information is explosion, big data, we have analysis gap, ability to analyze is falling behind the quantity of the data. And even worse, we have this junk data that is actually creating a lot of noise. So it prevents us from making good decisions. So how do I know that these instruments are working correctly? So we need to embed actually self-automation analysis to know that these are working properly, that are within the range. That's why I'm wearing 2, actually, so that I know how much it is off, because we are still at the development stage. Okay, data and knowledge are increasing, analysis ability, a number of physicians are dropping. So how to solve this problem? That's exactly what we are talking about. Artificial intelligence, automation, home healthcare. So that's the promise. So we know that this is a good solution and everybody is talking about it, but how do we do that is not done yet. And we have huge opportunity, these people, everybody now feel to actually make proper thing. I have already done work with my students and we are actually defining new software engineering solutions so that we can address non-software issues by our software, and we call it solution by design. We cannot do solution by default so that it's embedded in that because we don't know what default is. So we need to design it for solving special problems. Okay, so Smart Health Home contains wearables, fixed sensor devices, communication hubs, edge computer. This is inside the home. And from smart systems, it's connected to smart healthcare, smart hospitals, and smart home. We need to know the environment inside the home so that we can actually see what is the condition in which somebody is there. So if it's too hot and we are sweating a lot, The reason for sweating is most likely because it's too hot, not because we have some problem. And we need to eliminate these kind of things, otherwise it will be a lot of false positives. And false positives is what really kills the product. It's not false negatives. If we identify 30% correctly of something, this is a good product, as long as there is no false positives, because it's a subset of problem that's solved. False positives, this is what is the problem for us. Healthcare is home healthcare, e-health, telemedicine, and mobile health. So now I'm on mobile health. When I go back to China, it will connect to edge computer, a little box like this. And it will transfer the data. All the biometrics is this my data that I'm downloading. Stamping, smart contract, blockchain, but not blockchain, but smart contract. And off there, the document goes, this file has been generated, boom, boom, boom. Anonymization, document goes somewhere else for storage. The doctor can access it if I give permission for that. Very simple concept, right? It's just like cybersecurity. But it's about how do we get medical requirements of anonymity, safety, and basically create medical document at home that will be acceptable. What I said still doesn't mean that it will be accepted because there are inherent risks. Also, we have evidence-based medicine, evidence-based practice, and evidence-based health. This is what is currently big thing in medicine. This is guidelines. Even if we measure these things, we need to have a guidelines how we measure these things. And communication network, sensors, internet, so this technical thing. This is how we connect all these things. This is an example, 3-tier proposed telemedicine system. I don't want to say the authors because I will criticize it later. Everything is nice and beautiful. We have a robot. By the way, I'm buying a robot and we are programming it for medication distribution and telling, oh, it's too hot, do you want change of temperature, things like that. And we can see medical database, intelligent healthcare applications, family, we call emergency ambulance, we call. Imagine how many ambulances will be called in this system if it's not done properly. Challenges and new requirements is medical compliance. How do we capture data? How do we analyze it? How do we improve the use of knowledge? Because there is so much data and we need to improve the results. Who is the owner of the data? And it's very clear, it must be a patient, individual, or somebody who cares about them. Decision making, possible errors in decision making, how do we handle it? Who is responsible if there is an error due to this not functioning properly? It's certainly mine, I'm designing that, but maybe the guy who produced it. How do we do quality control? Oh, it needs to be certified as medical device. And then we are fine because we follow very strict standards. Solution is very simple, but we have to think in that way. It has to be a medical device, we follow the procedure. And if we can't do it, then we improve the electronics and the device. Safety, security, privacy, and regulation. And then we have all this health informatics certification, how to capture data by Internet of Things. These are the answers, how generally we go with that. But we need to, everyone needs to be done in high detail. And problem with why medical device companies don't do that, because they cannot make money from this. There is no money in selling these little things. Money is in managing the data and managing data properly. So it's in a data exchange center. Okay. So we have a system for sleep apnea. I was talking about it. So this is this thing here. Wear it overnight. This is heart rate, which is picked up overnight. Then we plot normal sleep using a modified Poincare diagram. People who know that know this is the time series in steps. And we plot it with delay. You can see normal sleep here is different to sleep apnea on the right side. And then we plot it and do the features, calculate the ellipse of that. This is mathematical side of that. And we extracted 15 parameters. Some are independent, some are dependent. So normally we narrow it down to 11. So it's 11 parameters from these plots. And then we found that they're separable. We can separate them into two groups. Then we run machine learning AI systems. And what is very interesting is that they're all more or less the same. So all of these things are classifiable. It doesn't matter exactly which system is better or not, but it is a solvable problem. And then we go over there and plot it. It has to be in the shape like they do it in sleep clinic. Doctor needs to understand what is the meaning of that. And it's our problem to modify it. Heart rate to actually sleep apnea, which is measured by stop of breathing, not by heart rate. And we can do that because stopping breathing reflects on heart rate in a particular way, and there are patterns which are there, and we are pulling them out. And then we can report this, and we can report 95% accurate from we have some 40 people, 20 with sleep apnea, 20 without, 95% correct classification. Now we go to hospital, because it doesn't matter what we do in historical data, it has to be shown in prospective data so that we know that it works. And this is the report that we create. So this is what we create, and it's similar to what medical doctors create. So we basically talk physician's language. Legal and regulatory compliance, how are we doing with time? Okay, we are okay. This is a tricky one. So, healthcare system stakeholders, government, hospitals, patient, system provider, and medical devices provider. These are people who produce it. These are the people who produce, service that, and maintain it. And they're not all. There are more stakeholders, and this is how they're connected. And you can see that we have actually some new functions. Oh, sorry. We have some new functions here. These are done by those broken lines. So the whole system is different as compared to existing system. This is the first alarm in terms of for hospitals to accept it. This is the first alarm because they're new procedures, and they're not covered, but they're standard operating procedures. And they're not going to accept it if I go there and talk to them. We need to go to the bosses above the hospital level and say there is political decision that there is reform and we are falling behind because we don't have technological solutions, and then get everybody to work together. So the acceptance will be done at higher level than just the hospital, policymakers. So we need to sell it to the government. And challenges and issues, just the most fundamental one is standards and regulation, and this is for all. Everybody has to be involved in new standards and regulations. And standards have to start first. Drafting the standard in China, government told to us, you have to self-organize and offer us standards, and start from informal groups. Of course, it is academic industry representatives of people who are in there. We cannot just go to a restaurant and pull out a group of people. And once when we do that, then it needs to go through proper system. And there are also medical adoption barriers of hospitals and community health centers, because they say, why should I be doing that? I'm just taking risk. And so government needs to encourage them, but government are encouraging, and they have it in the development plans across the world. And for patients, it's privacy, safety, and usability, the most important things that I'm worried about. I have this one is Huawei, actually. And I'm doing this for comparison to see what. First of all, this is not useful for me because it plots my heart rate. So what? I don't need to see plot of my heart rate. I need to see interpretation. Is my heart healthy? Does it behave like healthy heart or behaves otherwise? If it behaves otherwise, what kind of patterns? Is it like arrhythmia? Is it like hypertension? Is it like congestive heart disease? And in that case, I can move on and start developing responses to that. This one doesn't tell me anything. It tells me how many steps I have made. I can do it on mobile phone. I can do it from this. This is not a big deal. So I don't have medically or health meaningful data from this. But of course, they're sitting there and waiting for us to develop the thing, and they will be already on the market because they can produce better than I can. So that's why all of these things, if I want to make an impact and have some industrial success, it needs to be patented before it reaches anywhere. And in my group, we are developing innovation. It's innovation-driven development. We do the solution, we think about it, we patent it, we develop prototype, check it, and implement that. And only later on, when we do clinical trials or this kind of thing, then we write papers. Otherwise, it will be just taken by big players. Okay, standards and regulation. I will just go quickly to that. You need to understand there is a lot of regulation that applies, and it's not sufficient for what we want to achieve. We need additional one. So sensor devices, medical devices, consumer devices as medical devices, and the key is as validity, accuracy, and reliability, and effectiveness. We need to demonstrate that. And this is consumer device is not registered as medical device. The software is not registered as medical device, medical software, which means that we need to go through the process which takes 5 years for that. Medical software has guidelines, and we also need to have very strict software standards, particularly with quality assurance. And this software doesn't have it. And which means that we ourselves are not going to be able to do it. We need to partner so that we can bring it to the next level. Health data. We have health data protection. In America is HIPAA, GDPR in Europe, CDPL in China. It's already general framework is there, is present. Other countries have this. And we have medical data exchange protocols, personal health data protocols, and health data reporting. All standards and regulation exist for that. We need to deploy them one by one. And I don't have it here, but it's about 6 slides, densely listed regulations that we need to follow when we do that. It's serious business. Healthcare applications can be lifestyle intervention, remote healthcare, disease diagnosis and treatment support, and technology for health decisions. So those in green we have, those in red we need to develop. And, okay, so another thing is government started regulating, at least in China, they say, for those that we don't have standards, we need to apply ethical analysis. I happen to be head of ethics at university for 3 years, and I was implementing those things, so it came very handy for implementing in this thing, in health. And ethics is existing for sensor technology, data processing method, and data analysis approaches. So we need to cover it, and already some guidelines exist for that. But for smart health home, we need to develop complete new set of ethical standards. And I'm inviting everybody who is interested. I'm thinking about that we can actually build some kind of international consortium and do this kind of things. And developing this thing is publishable as well, because it's not going to affect our patents, because these are general standards that we need to do. So after the talk, you can see me and talk if you're interested. Okay, ethical issues is, we made this circle which has 6 steps. Safety and user trust, or somebody was talking about trust, right, before in the talks. And privacy and data security, vulnerable groups, how do we deal with children, sick people, elderly, so on. Transparency, explainability, or what was it, explainable AI, right? We talked about that. So you can see everything is in there. We are talking the same story, but how do we transfer it and implement it in practice? This is where we have this gap, huge gap, and this is what I'm trying to do. And we have fundamental principle is social responsibility and morality. And we are supposed to be self-regulating this. Because government cannot tell us what is the morality. They can only give us the guidelines, but they cannot put it in the law. And this differs between countries. So it's a lot of work that can be done. Now you see, conclusion, it's socioeconomic and normative problem that we need to solve rather than technical or medical. We need to package it properly. So if we do the right thing, just identify the issue, we can solve it actually quite quickly. But we need to start talking across the disciplines. Okay, so this is an example, guidelines for ethically informed smart health home software process. And we answer these questions. So we are even developing a software that will ask this question and it will score. It will get the ethical score of that. So we can automate or semi-automate this process. Like, is the proposed solution implementable? Sometimes we have perfect solution protocol, but it's not implementable for a number of reasons. It may not, we may not have enough battery life to implement something. And are there any regulation related to this product? If not, we need to find similar regulation and follow. Okay, this is kind of regulation that this product needs. What are the possible social impacts of this product? For example, who will have access to data? If we have 3 generations in one home, grandpa, grandma, mom and pa and children, should they have access to each other's? And who can have access to it? Who is the big boss of this data, if any? These are the kind of things we need to resolve. I think I know who you think should be the boss. It was a joke. I'm in China, and in China they don't have the same sense of humor. So I say something and I look at them and say, it was a joke. Medical adoption barriers, home, Internet of Things, and consumer wearable sensors not certified, and data are not validated and verified. Or even to that matter, medical devices need to be calibrated. Home medical devices not performed by trained practitioners. We can solve it. Good AI solutions for that. Health data sharing not standardized. Clinical validation efficacy not clear. So we can actually propose that. And more or less it will be accepted because we are qualified people, but we need to get other stakeholders. Okay, so this is medical laboratory. So basically, this is a blood test. And if you can produce something similar to that, that would be easy. Just need to have thing which is readable and acceptable. Doctors, they like to have something, I trust it, and it's in format. I look at this for 2 seconds, I know what it is. And that's the way they can use their time better. Okay, so we need to have smart medicine, wearables. Data goes into database. We can pull out patterns in there. Then we calibrate wearables with certified medical device, but also get this data so that we can compare. We do at the same time so we can compare the accuracy and validity. And then we have medical assessment that goes out, this data produced and supplied as laboratory tests, similar like that. This is how we do. This is blood pressure monitoring here. And we're using multiple devices to have an idea how it works at different positions of the body. And different devices, what is their accuracy differences. So we need to actually certify them and compare with the standard. And this is what you don't do. You don't measure blood pressure while you are doing it, but they do it in rehabilitation after cardiac surgery. So it's not standardized, but in hospitals they still use it cautiously. Okay, so we have a database. We have already nearly 10,000 hours of heart rate with different conditions. And this is our AI. This is healthy. This is, the blue ones are hypertensive, and some of them are controlled by medication. They behave like healthy. You can even see whether the thing works or doesn't work by summary graph like this. Congestive heart disease is over here. And arrhythmia, I didn't put it because it's everywhere. And this healthy thing stays in there, in this region. And if you go outside, this is the first signal, there is something wrong. We need to do another level of measurements with maybe medical devices. So patient's adoption requires to address privacy, safety, no harm, and improve health, and it must be easy to use. So Fitbit Apple user had data exposed in wearable device data breach. 61 million records were just given, were just brought and sold on the black market. Safety should be considered throughout the entire software process, selection of technology, design of the system, and implementations and deployment. And safety consideration is about how do I wear a device. I injured myself by wearing chest strap and sleeping with that. And there was a bruise that looked like cancer. And I showed it to some, took photo and showed to colleagues, and they freaked out. Oh, you should go to hospital, this looks terrible. You're going to die in 3 months if you don't look after that. And this is how people react to this kind of thing. It has to be safe. We shouldn't be sleeping with a chest strap. And misleading claims about diagnostic usefulness, this is what companies are trying to advertise, and now it's regulating more and more. And inconsistent or incorrect advice from adaptive systems, because systems learn. I would be very careful about self-learning systems. They need to be very, very carefully. Okay, Fitbit, 1 million ionic watches after a very limited number of explosions and burning, just exploded. And Zhang Xiang, she gave a talk before here, she burned herself because the battery exploded. So we need to be careful about that, which means that we monitor also the battery behavior. If we monitor battery behavior, chances of that are very low. But you can see it's million small things. And this is actually what we get heart rate, and this is where we identify that it's sleep apnea. This is mild sleep apnea. Okay, socioeconomics. So how to promote healthy development of continuous participation in smart medical and elderly care systems. People do the analysis of that, and those smart medical elderly care systems, the home-based care model, economic factors, how expensive it is, how much does it cost, and technological accessibility are important. Personal programs for the elderly are needed. It has to be personalized. One size doesn't fit all, which means that we need to go just like medical specialties. And I shouldn't be giving all complete solutions to everybody. It has to be selective to keep the cost lower. And the perceived risk for those smart systems was much stronger than perceived value. Elderly are scared more than they believe that it will help them. Socioeconomic, right? Cost and risk. Perceived risk as inoperative equipment, improper diagnosis, privacy disclosure. Financial risk. People are worried about financial things, considerable fees. How much it will cost me to run that? Financial fraud. Somebody will come and try to tell me something, and how do I know that it will be all fine? So it needs to be with medical system in there, not independent. And capital turnover problems. If they say basically, how do I know that your company will be there tomorrow? Why should I buy things from you? And utilitarian values, perceived values, functional benefits, meaningful information. Oh, the information has to be meaningful. 4 minutes, right? And which means that they have to be efficient and in good time. I have a person who has arrhythmia and say, I have Apple Watch and it tells me that I had arrhythmia yesterday. He says, no, I want to know whether my arrhythmia is coming real within the first minute. So I know I sit down and take the medication. That's the issue. So they are offering them non-solution for a problem. But people love Apple Watch because it's a fashion item, actually, and status symbol. Hedonic value, So they have to enjoy, they have to be happy by using it, they need to relax, oh, I have this thing, it's great, you should try it. That kind of thing is that you want to instill there, and they need to enjoy the use and feel that it's part of their life. Okay, so this is not applicable in practice, okay? And it's not applicable. You say robot will be telling you, oh, you have 3 months to live, but it's okay. It's not going to hurt you a lot. That kind of thing. It doesn't work. It has to be done. It needs to use language that medical personnel uses when they talk to the patients, and it has to be selective based on what the patient is. And safety, privacy, safe data transfer, certification, medical devices, none of them was even mentioned, or it was just marginally mentioned in this paper because it was just technical solution that looks good. As engineers, we do things that because we can, not because we should. And as engineers, we should learn that we should be doing things that we should be doing and take into account also non-engineering things. And that's coming back to software engineering principles, which says user requirements has to be satisfied. And the conclusion I already told you, we need to address the needs of all stakeholders, serve as medical laboratory, have certification as medical device, medical system software, and satisfies the requirement of all stakeholders. Socioeconomic and legal issues are primary, and secondary are only medical and technological issues. I thank you to all the members of my lab. There are too many to list here. I will tell you how excited I was during this talk. Body temperature didn't change much. Heart rate 96, yes, it's higher than normally. And now I'm more relaxed than I was 5 minutes ago.
Vladimir, thank you for this very insightful and amazing talk. This is the Certificate of Appreciation for your engagement in DSC Europe 23. Thank you very much.